From your name to your address, from your date of birth to your family's medical history, the confidential records of 60 million people are held by the NHS. But some of it could soon land in the laps of private healthcare companies operating clinical trials within NHS hospitals. Closer collaboration, says the Prime Minister, gives patients earlier access to cutting-edge treatments, and private firms benefit during harsh economic times. But is that justification enough to give away private information?
When you have anonymised data, it's still possible to identify individual patients within it. And obviously there are huge concerns then about companies targeting individuals who have a particular condition. So this is an area where the government has to tread very carefully indeed. They make all of this talk about red tape. Well, there are some areas where proper regulation is absolutely essential.
But the Department of Health insists all necessary safeguards would be in place to ensure protection of patients' details. The process, they also say, will be carefully and robustly regulated. But one viewer who's worked in the pharmaceutical industry for 40 years told Sky News cooperation with the NHS has always been close. Another said that they would refuse access to their personal records, while others see the incalculable value in trying to develop treatments and cures, albeit for profit. But for some groups, reassurance from the government should go further. Private companies themselves need to be open about what they're using the records for.
Really, the shoe should be on the other foot, and labs should be made to open up their doors so that we can know what's going on inside these labs, because a lot of them have an appalling record when it comes to animal cruelty. Undercover investigations often show animals being abused or neglected in labs, and people have a right to know whether or not these companies are trustworthy before they receive public information or our own private information about our health.
Robust regulation may go a little way to reassuring some patients, but successive governments' less than perfect track record on keeping private information out of the public domain may make this move hard to sell. Paul Harrison, Sky News.